on to look at mean arterial pressure and how it is regulated. Now, a lot of what we'll speak about going forward is really tying things together. A lot of factors that we have already introduced. We talked about the autonomic nervous system at length last semester. We talked about the heart, right? The SA node, AV node. So concepts that you should have already been introduced to. We're just going to put all of that together and talk about how we regulate mean arterial pressure. So the determinants of mean arterial pressure are heart rate, stroke volume, and total peripheral resistance. And we can kind of prove that via this equation that we talked about earlier. So we said mean arterial pressure is equal to cardiac output times total peripheral resistance. And if we substitute out a formula that we know for cardiac output, which is stroke volume times heart rate, we can see that these three variables are what determine the mean arterial pressure. Now, why is mean arterial pressure so important? Right? Exactly, it's what pushes the blood through the systemic circulation, okay? It is the driving force. I keep saying that. Make sure you remember that phrase. It is the driving force of our vascular circulation. Without mean arterial pressure, we have no circulation, okay? Very, very important. So the importance of understanding the regulation of mean arterial pressure has to do with how well our tissues are perfused, how well they are oxygenated, and that is controlled by neurons, right? Mainly the autonomic nervous system and hormones as well, which we will look at. Also controlling the mean arterial pressure are the low pressure baroreceptors. We call these volume receptors, and we'll look at how these play a role with mean arterial pressure. So this next image really just indicates or kind of clears up that relationship between cardiac output, mean arterial pressure, and resistance, okay? So in the first part of this image, cardiac output, which is coming from the heart at a steady rate, has a constant or steady mean arterial pressure that is regulated by a steady amount of resistance, right? So this is all constant in that first image. And at the end here, the state of the radius is what we are using to determine total peripheral resistance, right? So make sure you're making that connection. Total peripheral resistance lives where? Where does total peripheral resistance live? When we say TPR, what are we really talking about? The arterial wall, okay, guys, we talked about this, right? The TPR is the highest across the arterioles. So whether or not that vessel is constricted or dilated is really the biggest indicator of TPR, okay? So looking at the state of the arterial radius is where we look to determine TPR. Now in the second part of this image, for a higher flow, for a higher cardiac output, we must increase mean arterial pressure when the total peripheral resistance remains the same, okay? So if we have a constant radius and we have more blood coming through the system, we must increase mean arterial pressure. That only makes sense, okay? Likewise, if we have a constant amount of flow, but we have a smaller arterial radius or we have higher total peripheral resistance, then we must also increase mean arterial pressure. So think about it, you have blood coming through your systemic circulation. If the arterioles are smaller, the pressure will naturally increase, right? So this is just another way of showing us the relationship between cardiac output, mean arterial pressure, and resistance. So we're going to go through the determinants of mean arterial pressure one by one. We're going to start by looking at the extrinsic controls of arterial radius, and this should be a review at this point, right? We talked extensively about how the size of the radius of the arteriole is controlled. So basically, mean arterial pressure is regulated through controlling heart, cardiac output, as well as arterioles and veins in terms of TPR. So just reminding ourselves, when we talk about TPR and veins, what are we talking about? There isn't a whole lot, but we just mentioned what exactly brings that about. What are we speaking about when we say TPR of veins? Although it's very minimal. Not the valves. Another factor that we just spoke about. Not the wall. Well, yeah, the walls. What about the walls? That's a good start. Yep, so a little bit about its compliance, but more specifically, the tone, that venomotor tone that we talked about earlier. So the mean arterial pressure is regulated through the venomotor tone of the veins, as well as the arterial radius, those two factors we talked about, and then things like the heart rate, the ventricular contractility, which are factors we looked at last semester when we talked about the sympathetic effect on the heart. So that's going to be neural control through the autonomic nervous system, as well as hormonal control. Okay, so once again, we're really just tying up a lot of things that we have already spoken about here. Okay, going back to this really important equation of flow. So the importance of flow is that it is basically perfusing our tissues. And we know that it is determined by the pressure gradient divided by the resistance. So when we regulate mean arterial pressure, this is vital to normal oxygenation, normal tissue function, normal tissue perfusion. Okay, understand that if we have too high or too low mean arterial pressure, we throw off homeostasis. Specifically, if we have too low mean arterial pressure, what's going to happen there? What's going to happen if we drop mean arterial pressure? Not enough flow, meaning not enough blood, right? Not enough oxygen, not enough nutrients. So tissues are going to become hypoxic. If we have high mean arterial pressure, what do we see there? Hypertension, right? That's going to be a stressor to our heart. It's going to have to work twice as hard, as well as to our vasculature. Our vessels are going to have to sustain those high pressures, and this is where we get strokes and hemorrhaging because of that damage to the vascular walls. So these can be dangerous or detrimental. Now, which of these do you think would be a more imminent threat to our survival? Which? Hypotension, right? Or not enough perfusion, okay? So it's really important to point out that low mean arterial pressure is a much more immediately detrimental disturbance than is high mean arterial pressure, okay? Really important to point that out. So as we speak about regulating mean arterial pressure, the factors that bring mean arterial pressure up are of much more importance, all right? This can be fatal. If your mean arterial pressure drops too low, if you're dehydrated, if you're bleeding out, if you have hemorrhage or a stroke, this can be imminently dangerous, right? Immediately dangerous or fatal. Okay, so it's really important to point out the factors that help to bring mean arterial pressure up because they're much more important in the short term.